So there's a group of high-grade lymphomas that have genes that drive dysregulation or drive changes in cellular processes that become rearranged. They get partnered. They get put into the wrong place within the genome. And what it means is it results in these genes being overactive, and they're very, very active. And there are genes. There's a gene called MYC which drives the division of the cell, and there's a gene called BCL2 which stops the cell from dying. And if you can imagine, like driving a car, the MYC gene, when that's overexpressed, is like putting your foot straight to the floor. It's saying go faster, go faster, go faster. And normally we would have the brake to stop that from this gene that controls cell death. But that's not working, and we're producing more and more anti-cell death factor. So it's like the brake doesn't work. So you've got this opposing action of the cell dividing but also not dying. So you can imagine that's a very powerful signal for the cell to divide. So we can identify this in people with high-grade B-cell lymphomas by a technique called FISH, where we look using special sort of molecular paints in the chromosomes to see the position of these genes and to see if they are sitting in the wrong place. So this is a subgroup, maybe 8 to 10% of patients with large B-cell lymphoma that have this special molecular aberration, this molecular subgroup, and it's those patients that we feel are not well served by conventional R-CHOP chemotherapy. And what we're trying to do is to look to see if there is a benefit from using more intensified treatments for patients with this so-called double hit lymphoma.